really. In fact, breast cancer is possibly the most heterogenic disease when you're talking about cancers. And what I mean by that is that there's at least 35 different subtypes of breast cancer. And within that, a whole smorgasbord of mutations that can actually lead to a very specific type of breast cancer and a very specific type of response to treatment. So breast cancer is completely different in every individual that has been diagnosed. And there's a lot of reasons that make it different. At the very highest level, we have breast cancer that is what's called ductal carcinoma. So invasive ductal carcinoma, it's the most common kind of breast cancer, and dealing with the ducts of the breast. Then you have breast cancer that starts in the skin, called inflammatory breast cancer, that doesn't even have the characteristic tumor. There's no lump. You're dealing with simply a red rash that can actually look like a sunburn, or in some cases masquerade as mastitis or a breast infection. There's breast cancer that starts in the lobules, and there's breast cancer that starts in the in both places, both lobules and in the ducts. So within those different subtypes, you have different prognostic indicators and certain receptors that can actually help the cancer grow. So we're dealing with estrogen receptor breast cancer, which means it's using estrogen to bind to it and help it to grow. The majority of breast cancers, about 75%, are estrogen receptor positive, and this is true in males as well. So male breast cancer patients still have, in most cases, estrogen receptors that allow it to grow. Same thing with progesterone. There's also another protein we talked about before, which is HER2, that allows breast cancer to be especially aggressive and grow a lot faster than other types of breast cancers, about 20%. And then there's breast cancers that don't relate to any of those particular prognostic indicators, what we call triple negative breast cancer. Science is trying to figure out, it's not triple negative, but it's positive for something. So when you have all these factors and your tumor's been biopsied, the pathology report is going to indicate what you have going on, and this is going to tell you what you need to know, so you have some idea about how to go forward with your treatment process.